Three agenda items today. Would you like me to introduce myself first?
Yes, and your colleagues as well.
I'm Kevin Schrum. I'm the administrator of the Mental Health Intellectual Disabilities Early Intervention Program.
Good morning. I'm Holly Leahy. I'm the Director of Mental Health Services for Lebanon County MHIDEI.
Good morning. My name is James Donmoyer. I'm the Executive Director of the Lebanon County Commission on Drug and Alcohol Abuse.
Welcome all of you. Thank you.
Thank you. We have three agenda items, the first of which is for the MHIDEI program. We have several contract amendments. We do this periodically as the needs of the people we serve change, or if there are rate changes or new providers. Currently, the summary that we have has 23, I believe. 23 amendments to our provider contracts. And even though there are 23, the total change in the contracts for fiscal year 17-18 is $161,577. Some of them are for increased units of service to meet the individual needs of a consumer. Some of them are rate changes. We did have some direct care worker initiative funds for providers, and then a couple of odds and ends. In terms of funding these changes, this increase in the contracts, we will fund that within our existing budget. We're not seeking any additional funds from the county commissioners.
Also move to accept the contract amendments totaling $161,577.
I'll second the motion.
All right, I have a motion and a second to honor those contract changes. All those in favor indicate by saying aye.
Aye.
Opposed? So ordered.
Thank you very much. Next on the agenda, we would like to present the Lebanon County Human Services Plan for fiscal year 2018-2019. We come in every spring with a new plan. There's a group of county staff that put this plan together each year. It includes myself, it includes Mr. Dunmoyer, it includes Mrs. Leahy, and there are also representatives further representatives from our department, such as the ID program, housing, CHIP, etc., CASP, our fiscal director, and then our children's unit director. And we also have participation from Jim Holtree at Children and Youth, and we have participation from Phyllis Holtree from the Community Action Partnership. So each year we put this together. We each have our own piece of the puzzle to put together. Unfortunately for Holly, more than half the plan is mental health and requires a great deal of energy and effort from Holly and her staff. And the idea of the plan is to look at any changes you've had through the year, and then look at the existing or the current strengths of your program, and then the current needs of your program, and look at the inventory of services that are available and see which ones are still missing, and try to identify plans for the future. Without going through the whole plan, in terms of mental health services, which again, as I said, is the lion's share of the plan, some of the highlights for 17-18 were that, and even though it wasn't our program, the Day Reporting Center impacts the people we serve and assists them. True North Wellness Services is now online to do functional family therapy, so we were excited about that new program. The Fairweather Lodge that we had spoken to you about and you had visited, that is now up and running. And that was a new program. It took a little time to get going, but it's there and it's going well. And we have new extended acute care beds at Wellspan Ephrata Hospital, which is a valuable resource for us. And then we also have the New Start program, which provides 10 individual apartments for people with mental illnesses. So those were some of the highlights of the fiscal year that of 2017-18. And then we look at various groups, target groups, elderly, children, prison population, duly diagnosed folks, and so on, and try to, again, identify the strengths that we have in the program to meet their needs, and then also identify the areas where it could use improvement. So that's really a very brief overview of the biggest piece of the plan. I don't know if Jim wanted to add anything about drug and alcohol.
If I could, that would be great.
Sure.
I want to echo Kevin's comments earlier about the collaboration for this plan, and the drug and alcohol portion of this plan is nowhere near as lengthy as the mental health part of this plan. However, I just want to point out for the commissioners and everyone here today that the plan, what they asked for from the drug and alcohol department, from our office, basically they want to know what Lebanon County has as far as treatment services. They want to know what our continuum is. Do we have a continuum from the basic form of treatment, which would be outpatient, to the most severe or the most complex detox, rehab, MAT services, and so forth. So the part of the plan that I developed with my staff was making sure we outlined what services we have in Lebanon County. The second thing the plan asks for, they're real interested in access. We have those services, but what's the access like for those services? So they're real interested in wait list information. Do we have wait lists in Lebanon County? Are people waiting around to get these services? So we had to provide them with some statistics and some information as far as wait list information. The third thing the plan asked for is overdose survivor data. We had to talk about our numbers as far as overdose survivors ending up in the ER at the WellSpan Good Samaritan Hospital. And we had to talk about our plan around taking care of the overdose survivors, which they refer to quite often as warm handoff. So we had to put this in the plan so they knew that Lebanon County was up to speed with overdose survivors. They also ask us about our clients, numbers of people in reference to the levels of care, how many people we put in rehab, how many people we put in detox, how many people we have on MAT treatment, how many people are outpatient. So they want to know that we say we have those levels of care, we say there's access, they want to know how many people accessed all that stuff. And then finally, they ask for, there's some changes. They want to know if we're using Narcan, who's using it, how often are we using it, where can people get it. And they also wanted to make sure that our county, our employees, our providers are being ASAM trained, which is a transition away from the PCPC, which, for those of you not familiar with the PCPC, it is currently the tool we use for assessments to determine what level of care an individual needs. And we're going away from that, and we're going to go towards the ASAM. So everybody in the state who does assessments for drug and alcohol treatment needs to be trained. So these are the things that are the hot topics, so to speak, I guess, at the state level, federal level, and that's what's part of our plan. And I'm here to answer any questions in regards to the drug and alcohol portion of the plan.
I just want to thank Jim, my liaison, and thank you for all the innovative work that your team is doing in this fight. So we appreciate the quality of your work as well.
And I do I appreciate that, and thank you for saying that. It's funny though how our plan is so different in what they're asking us than the mental health plan. It changes every year. It would be nice if they would say, what are our new programs, what are our strengths, we have a lot of things that happened in the last year or two that's unique to Lebanon County as far as drug and alcohol treatment. So it'd be nice sometime to have the opportunity to let them know what's going on, other than the questions they ask us.
Commissioners, do you have anything?
Was that a motion?
No, there was no motion, I just wondered.
Oh, yeah,
since
I do
we're
have a
good-
comment then. I
Yeah.
didn't know if we had to adopt the plan, though.
Well, we will adopt
Okay.
it.
All right. Well, I have always appreciated the cooperation between our department heads. It's outstanding because we have many citizens with multiple diagnoses, whether it's mental health and drug and alcohol or whatever it might be. Some are children, some are aging. I don't know, maybe now, but in the past that other counties had this approach. And you guys just build so much confidence in me as a commissioner. I can't speak for my colleagues, but we trust you, and we know you're doing it for the right reasons, and you're doing the right thing to help the citizens of this community. And it's so touching to see that kind of cooperation across the county. I mean, we have 11 people sitting on this board from different departments. That speaks volumes to the services you provide, and I can't thank you enough on behalf of the citizens of this county. Thank you.
Thank you. We appreciate the feedback. I agree with you. I think, and I don't know if it's because we're a small county who have had people here for a long time, but I think we've always tried to partner and try to do what's best for the people we serve and leave egos and issues like that behind and try and do what's best and try to use the money in the best way possible too.
But that strength is so cool, because when there's a new department head, you bring them into the fold and you teach them what you've learned and what works here. And that makes this place very special to live. And I do have one question. At the Fairweather Lodge, did they come up with a plan for a business? I thought that might have been something that was being suggested.
Currently, 2 individuals are employed. One is seeking employment, and we have other people who are in the application process. So we currently have 3 residents, and I don't know if you want to add to that, Holly, in terms of what the future plans are, but
Sure.
all of them.
So I think that the ultimate plan is to kind of wait and see the individuals that are residing in the home, and then what are all of their unique strengths and skill sets, and then look toward building a business out of the home. For the time being, just ensuring that everyone is employed and bringing that income into the home, and the sustainment of the home is really important. So I believe it'll be a little bit further down the road that they'll look to build that business, and I have no idea what that might look like based upon the 3 individuals, but we don't know who will be joining them in the home either, and what their skills will be as well.
Well, thanks for the update. I just thought I'd ask because I was curious.
Sure.
Thank you.
We're all curious.
Yes.
Well, we are going to accept the motion and pass your plan, but since we kind of turned this into an open forum, I was encouraged, Kevin, and kind of surprised by your mention of the day reporting center. So would you comment a little bit on what role you see that playing in what you folks do?
Sure. I mean, some of the people that we serve have involvement in the criminal justice system. They're served by multiple agencies in the county, which is similar to what Commissioner Litz is talking about. They're many times just not one isolated issue in their lives. So any support that they get in the community that keeps them out of prison is a positive. And any support they get, and the staff there working with our staff to try and meet the needs of the individual, it just adds to the array of services that are available for the people we serve. I don't know if Holly needed to add anything to that, but we just look at it as just another opportunity for them to get some services in the community to help them recover from their mental illness. And
not to put you on the spot, but how many folks are we talking about over the course of the short life of the day reporting center now, approximately?
I don't have an answer. I don't know if Holly can pull that out.
I think there's been approximately 50 that I'm aware of.
Okay.
So that may not be a firm number. I know there have been many individuals who've already gained some really wonderful skills from being a part of that, and hopefully then keeping them out of that vicious cycle in the forensic system. So it's really encouraging to see those positive outcomes with the individuals participating. So it really has been a wonderful addition to Lebanon County and the services and supports.
Thank you for sharing that with us.
Sure.
We did need to hear that. So yeah. And then I have one more question. questions for Jim. Is there anything significant changing on the, as far as the opioid problem and so on here in Lebanon County?
From my standpoint, no. It seems to be steady as usual. We continue to see, last year we had 27 overdose deaths. We continue to see those numbers be consistent. Even, from January, February, March, 6 months into the year, we're seeing the same type of numbers. In addition to that, our office continues to, half the clients that we see in our office are heroin opiate related people that identify that as their primary substance, and that has been consistent for the last 3 years now. So from my standpoint, not changing, but from our resource standpoint, there's a lot changing to address that.
Okay, thank you. Anything else?
No, just this afternoon you're busy. You're presenting at Lebanon
Yes.
Valley College.
Wait, can I give a shout out?
This is your moment.
Yeah. We're having an event tonight. It starts at 1 o'clock this afternoon, goes to 8 o'clock tonight. My office is sponsoring the event, paying for the event through our heroin task force money funds. And our prevention provider, which is Compass Mart, and our student assistance provider, which is Empower the Mind, came together, collaborated to put this event on at Valley College. Again, it starts at 1. They're going to have a keynote speaker. They're going to have food. People can come and eat. The event's free. If you want to come and see me, between 4 and 5:30, I'll be leading a panel discussion on hot topics concerning drug and alcohol abuse and use and treatment and so forth. After which, they're going to have work sessions, and people are going to be able to go to 3 different places depending on your interest or your need. And we're going to have professional staff there to lead these groups and talk about, I think the title is, I should know the title, but it's Faith, Addiction, and Recovery, I think is the title, but it's free to the public. If you're a professional looking for CEU credits, they're available as well. So we hope to have a good turnout.
Who all was invited?
Everyone that I know. No, I'm just on Facebook. All our people that are involved in the task force made all their contacts. We've been getting phone calls all day, yesterday, the day before. Seems to be a lot of interest. So word is getting out. So I don't know it's invited. We've invited all the providers. There will actually be providers there with tables for resources. People can get information. It's kind of like the Chris Herron thing we did last year, minus the huge cost.
Thank you. Did you have a pre-registration, Jim, or no?
There is if you do not need to register, you can just show up. But if you're looking for credit, you need to go on compassmark.org, and you can register on that site to make sure that you will get your credits for attending the event.
Okay. So now that we've gained all this information, do I have a motion to approve the plan?
So moved.
Second.
All right, I have a motion and a second to approve the plan as presented. All those in favor indicate by saying aye.
Aye.
Aye. Opposed? The plan is accepted.
Thank you very much for your support. We have 2 signature pages for that.
And you have one other item? Is
One
that
other
correct?
item, if we could. Our mental health program has been working on a project. And I'll give a brief background of the project. We currently have 29 beds available to us at Warnersville State Hospital for people with mental illnesses. The Commonwealth is transferring folks from Norristown State Hospital to Warnersville to increase the number of forensic beds across the Commonwealth. Because of that transfer, the state is strongly encouraging counties to accept what we call a CHIP project. And in a CHIP project, what we do is we permanently close a certain number of beds, and in turn, we get a set number of dollars for each bed on an annual basis. And currently they're offering us $105,000 per year for each CHIP bed. And we've developed a plan to use that $315,000 to develop what's called an enhanced personal care home, and Holly refers to it as an SCR, or specialized community residence. And this differs from a traditional personal care home in that it is designed to meet the needs of those with physical challenges, not quite to the point where they need nursing homes, but they do need assistance with physical needs on a daily basis. It's something we don't have now, and we do have some older folks at Wernersville State Hospital. So Holly's been doing a lot of homework with her staff, visiting various SCRs to see what they look like, see how they function, see what the costs are. And so we are currently, we did a request for proposals. We found a provider that has a proven track record and currently runs 8 of these projects, so they have a long history with it. And we think it could be a win-win for us if we get, we lose 3 beds and serve those 3 people in the community, but then can serve additional people in that enhanced personal care home who have the physical needs. We could serve, we think, a total of 6 to 8 people in that.
For what you're spending now on 3, is that?
Well, we don't actually spend that money. The
Okay.
state funds the beds at Wernersville
Okay.
State Hospital. But now, since they're shutting down those beds, they don't have that expense for those beds. They give it to the counties.
Okay.
So we would take the money we're getting from what this is called a CHIP. It's an acronym.
Mhm.
And then we would have that available each year to fund those beds. And instead of serving 3 people, we could serve 6 to 8 people. And like I said, there's nothing else in the community to serve that specific population. And so we think it would be a win-win for the people that we serve. We could serve the 3 we bring out, plus some additional folks in the community. The program, as we're proposing it would be managed by Keystone Human Services, which has a proven track record in Pennsylvania and the United States, and I think they even run some programs out of our country. So they have a long proven track record of providing quality services to people with mental illnesses and to other populations, but they've been doing this for a long time, and we would like to partner with them to do that. So I would try to answer any questions you might have, but we are seeking your support.
I do have one.
Yes,
Do
sir.
they provide the actual facility, or would we be providing that?
They would provide the facility. They would identify a facility, modify it as necessary, all within the budget that we have. We anticipate the costs will be a little more than the $315 we will get, but we believe we can shift dollars elsewhere to fund that, and again, not come to you to ask you to fund additional dollars for that program.
I'll make,
Other questions?
I was gonna say, I'll make a motion to approve the Keystone proposal to run an enhanced personal care home proposal with the $315,000 from the state and a little bit from the existing budget of MHIDEI.
All right, I have a motion and a second to approve the request. Gordy, did you have a question or not?
Yeah, I just, Kevin, generally, how many beds at Phil Haven do you utilize at any given time?
Holly?
Wernersville or Phil
Wernersville.
Haven?
I'm sorry,
At
Wernersville.
At
My
Wernersville.
apologies.
All 29.
So
Oh.
you're full up over there.
Yeah, virtually every county isn't. Generally, we've been fortunate for the past, I think, 6 months, we didn't have a waiting list.
Mhm.
And now I think we have 1 person on a waiting list, but there's some counties that may have a dozen people on a waiting list for services there. We do have a relatively new level of care between the acute hospitalization at Phil Haven and the long-term hospitalization at Warnersville. It's an enhanced, it's an acute care, extended acute care program to sort of fill that gap when they need more than the acute care, but don't need the long-term care. And the intent is to stabilize individuals and return them to the community as soon as possible with the supports they need.
Now, just so that I can be clear, this facility with the $315,000 you're going to get from, I'm assuming, giving up 3 beds
Correct.
at Warnersville are more or less for people who have more special needs, are less ambulatory than those people that might be in other beds up there.
Correct.
Okay, thank you.
All right, any other questions? All right, having answered those questions and having a motion and a second to approve the optional program here as presented, all those in favor indicate by saying aye.
Aye.
Opposed? That's it.
Very good. Thank you.
Thank you.
We appreciate